We're now going to start the neck and chest sections of the fetal pig dissection. So we're going to begin where we left off. We can see that right down here is our diaphragm where my fingers are located. And I'm going to continue this incision right up midline, right up to the chin. Now, I've got to be careful again. I'm going to be cutting through some cartilage, and I don't want to go too deep because I don't want to cut the heart. I know that's in there. And I've also got a thyroid gland right under the neck too that I don't want to damage. So I've got to be careful of those structures. So with my fingers out of the way, I'm going to make an incision midline right up to the chin. And I'm going to slowly open this up. There we go. And I'm going to open this up just a little bit more. A little bit more. And there we go. With the probe, I'm now going to get in here and open some of this chest cavity up a little bit. You can now see the diaphragms coming into view just a little bit more. This layer of muscle right here is all diaphragm. So I'm going to do the same thing to the other side. I'm going to try to free it up just a little bit and pull some of these structures away from the rib cage. Again, you might have to get your fingers in here a little bit and free up some of those structures. So all of this, and I'm going to cut this very gently here. All of this material right here is going to be the diaphragm. So I'm going to cut this a little bit more. I can see some fluid there. I'm going to drain that. Just make a little cut there and drain that out. And you can see the chest cavity opening up nicely here. We have the lungs, and we can see the heart and the other lung. And then what I'm going to do here is you can see this saran wrap-like structure that surrounds the heart. That's going to be the pericardial sac. And the heart actually beats inside that sac, and it allows the heart to move almost without any friction. So that pericardial sac is going to be very important. I'm going to cut this a little bit more and open this up. So again, be very careful of the fingers. I'm going to cut through some of this bone. There we go. I've actually cut a little deep right there. I can see that is the larynx. And there we go. Cut this also so I can get in here and visualize structures a little bit better. Okay. Now I've got some cartilage around here that I want to get rid of, probably the collarbone. And I want to get rid of that cartilage. I'm going to go in there and try to open that up and move that out of the way. Now, I've got to be careful here because there are some structures that I want to take a look at. Okay. There we go. So let's go ahead and begin, I guess, with the lung. I'm going to take a piece of the lung and I'm going to cut it just like we did with the frog. I'm going to cut a section of the lung out. There it goes. And you can see that this lung, unlike the frog, is solid. It looks very solid except for some blood vessels, maybe some bronchial tubes. It's very solid. Now if we were to look at that through the microscope, we would see a lot of little nooks and crannies. And those little nooks and crannies would be millions of alveoli that are in the fetal pig lung to increase surface area for gas exchange. In the frog, this was mostly hollow, so the frog had to rely on its skin for gas exchange in addition to its lungs. Let's go ahead and take a look at the heart. We showed the pericardial sac, and we can see if we remove that pericardial sac, and that's what I'm going to do. I'm just going to remove that gently. And I can see this structure right here. It's a darker structure at the top. I've got my probe underneath it. that is one of the atria. In fact, this is the right side, so that's going to be the right atrium. Now on the left side, right here, we have the left atrium. And all this large muscle is going to be ventricle. Now, we can see this other blood vessel coming down, spiraling around the heart. That is going to be the coronary artery. That is one of the first arteries off the aorta to feed the heart. The heart needs to get blood first. Now, this coronary artery can serve as a landmark. This coronary artery is going to separate the left ventricle from the right ventricle. So this would be right ventricle, this would be left ventricle on this side. We can also see some blood vessels come off the heart here. I'm going to move this just a little bit. You can see two blood vessels there. This blood vessel is going to be the pulmonary, well, this is the right ventricle. So this is going to be the pulmonary artery. It's a nice thick artery, so that's going to be the pulmonary artery. And this is the left ventricle, and we can see on the back side, we can see another blood vessel coming up. That's going to be our aorta. That's the aorta. It's going to curl around and it's going to come down midline, and we're going to catch it in the abdominal and pelvic cavities. So again, if I come down to the abdominal and pelvic cavities and I get some of this preservative out of the way, we can catch that aorta right here. There's the aorta. And right on top of the aorta is another structure we didn't name earlier. This is going to be the rectum. This is the terminal end of the large intestine, and you can see it diving deep. Along with the aorta is going to be this other more purplish structure, or bluish structure. That's going to be the inferior vena cava. And then of course with our kidney, we're going to have a ureter come off of that kidney. So be sure to name all those structures and take a good look and identify those. So going back up into the chest again, I want to go up into the neck region just a little bit further. And I'm going to clean this stuff out just a little bit, kind of cut through there so I can see things a little bit better. Again, watch the fingers. And there we go. And I'm going to open this up just a little bit here. And I can see some blood vessels going up. Looks like maybe the carotid artery going to the brain in the head. That's going to be it looks like the carotid artery maybe. And then we see this gland. I'm going to clean this up just a little bit. You can see this kind of oval egg-shaped gland right here. This is the thyroid gland. And it's going to sit just below this other cartilaginous structure that actually got cut just a little bit here. That's going to be the Adam's apple. That is your larynx, otherwise known as your voice box. That is the top of the trachea. You have this large, dilated, cartilaginous structure at the top of the trachea called the larynx. So if you find that, you can feel that with your finger, just below it, you can see the thyroid gland. Very important gland. If I move that out of the way just a little bit and clean this up, you can see this ribbed sort of structure come into view. I'm going to clean that up with my probe, not my scalpel because I'll slice it all up. And you can see it right there. You can see those cartilaginous rings. You can feel those with your finger. And that's part of dissection. Get in there and feel those with your finger. That is going to be our trachea. And those cartilaginous rings, actually C-shaped rings, are there to prevent the trachea from collapsing under low pressure when we take a deep breath. Just underneath that, we see another tube-like structure come into view. And I'm going to get my probe under it. There it is right there. That is going to be the esophagus. So look for that esophagus. And those are some of the structures that I want you to see around here. If I come up into the neck a little bit, I'm going to try to get underneath this skin just a little bit. Maybe I'll cut some of this skin away. And I'm going to see if I can see a muscle here. And I'm going to pull some of this skin away. Get in there a little bit. Let's see. And what I'm looking for here is a salivary gland. We can see this large muscular structure right here. And that is going to be the masseter. This muscle is actually very important in biting down or closing your mouth. If you actually take your mouth and bite down with your teeth, you can feel that muscle tighten up right under your cheek. And you can also see, again, another glandular structure coming into view here. And it's looking a little grainy. So again, we're looking at some type of gland. This is going to be your salivary gland. This is one of your many salivary glands that create saliva. So I've got my finger right underneath that salivary gland. That's it right there. Now there's one more structure that I forgot to go over, and it's down near the heart. So if I go down to the heart again, and I moved it out of the way without even mentioning it, but this structure right here, you can see it overlying the heart. It sits right on top. Here's the heart right here. You can see the blood vessels underneath it. So this would have went right over top of the heart. It sat right there. And you can see that it starts on top of the heart, and it actually goes up on either side of the neck. Here it's been cut up just a little bit. So it has a chest portion and a neck portion to it, a cervical portion. This is the thymus. This is an important gland in the immune system. And the thymus is actually responsible for T cell maturation or T lymphocyte maturation. And that's going to be an important structure in T cell maturation, which is going to help our immune system fight germs. So make sure you take a good look at that. It's largest when we're born, and then after it becomes smaller and smaller and smaller. Now, the last thing I want to do in the chest and neck area is I want to cut this larynx open so we can actually take a look inside the larynx. So I'm going to very gently cut that, and I'll actually cut a little bit of the trachea. Get my thyroid out of the way. Cut that trachea a little bit. And again, I don't want to cut towards my finger, so I'm being very careful here. And I'm going to cut that larynx right in half. And I'm going to open that up just to see what it looks like. And you can see the larynx, you can see the cartilage that makes up the larynx. Just take a look at that. You can also see right here where I opened up the trachea, and you can see those small cartilaginous rings. They look like dark red dots. Just take a look at that, feel that with your finger, and take notice of that area. Now, the last thing I want to do is I want to come down to the groin area, and this is a male, so we're going to cut this groin area open right in around here, right near the tail, and you can see it slightly bulging out right there. And I'm going to see if I can do this. So I'm going to make a cut right through here. I'm just going to do it midline, cut right through there. I'll open that up just a little bit with my fingers. And I can see the structure right here. There's going to be another one. I'm going to just take the probe. I can feel it here with my finger. And I'm going to take my probe, kind of put it in there, pull it out just a little bit, not too much pressure there. And I'm going to pull that out, and we can see that this is going to be one of the testes right here. So if I open this up a little bit, cut some of this tissue away, I should be able to visualize the testes. And let's see. So I'm going to take my scalpel, and I'm just going to gently, with the very tip of it, open that up so I can see what's actually inside there. And I'm going to move that out. And maybe it would be easier if I did this with the forceps. And I'm going to move that out. And you can see right here, I've got it in the forceps, that is the testis right there. And then around that is going to be the epididymis and some tubes that eventually become the vas deferens up a little bit further. But that's the testis, where your testosterone, for the most part, is made, and also sperm production takes place. That's going to be the testis. And that's all we want to see down in the groin area. And that's going to be it for part 3.